All right, it just hit 12 o'clock, so we'll go ahead and get started here today. Good afternoon, everybody. My name is Troy Jorgensen. I'm the program manager for Project ECHO Nevada. I see a lot of new faces today, so thank you for joining us for today's Geriatrics ECHO series. So a little bit about ECHO. ECHO is a telehealth program that originated in New Mexico at the University of New Mexico in Albuquerque in the early 2000s, and we adopted it here at the UNR School of Medicine in 2012. And yeah, like I said, it's a telehealth program, so it's really about connecting all of the great resources and subject matter experts that we have here at the university and in Reno with healthcare providers, mental health providers, all across the state of Nevada. Really, it's useful for consulting on difficult patient cases, patient-related questions, that sort of thing, and then receiving CME or CEU credit as well. So the sessions will start off with introductions. So you'll meet our hub team and subject matter experts for the day. We'll go out to all of you and have you introduce yourselves as well. Then, like I said, we really want to support you in your practices with any patients, questions, that sort of thing that you have. So we'll open it up, give you an opportunity to ask some questions to the team, and then we'll get into the didactic presentation for the day. So again, I'm Troy Jorgensen, Program Manager for Project ECHO Nevada. We'll go around our team here. Sneha, do you want to start us off?
Hi, I'm Sneha Sharma. I'm the Program Coordinator for Project ECHO Nevada.
Thanks, Sneha. And Dr. Levy?
Hi, good afternoon, everybody. Mordechai Levy here. I am the medical subject matter expert here for our geriatric ECHO. Happy to see everybody. I want to encourage everybody to turn on their video camera if they're able to. It helps a lot with the discussion. So thanks everybody for being here.
Thanks, Dr. Levy. Leslie?
Hi, I'm Leslie Baker. I am the geriatric pharmacist on the Project ECHO team and also the geriatric pharmacist at the Sanford Center for Aging.
Thanks, Leslie. Kelly McMillan?
I'm Kelly McMillan. I'm a social worker. I'm part of our geriatric assessment team, also provide some other services within the Sanford Center for Aging where I work, and part of this Project ECHO team as well.
All right, Kelly Presser.
Hi, I'm Kelly Presser. I am the nurse on the geriatric ECHO team. I'm a clinical nurse leader at the Reno VA.
Thanks, Kelly. Patty?
Hi there, I'm Patty Swagger. I'm with the Sanford Center for Aging, and I would be the clinical education specialist on the geriatrics ECHO team.
Thanks, Patty. And then our guest speaker for the day, Jamie.
Hi, everybody. My name is Jamie Ahumada, and I am the State of Nevada No Wrong Door Coordinator.
Thanks, Jamie. All right, so that's our team for the day and our subject matter experts. So we'll go out to all of you and get to know you guys a little bit. So Giovanni Margaroli, do you want to start us off, please? Looks like you're finding the mute button. There you go. Go ahead.
Can you hear me?
Yep.
Oh, wonderful. It's working then. Okay. My name is Giovanni Margaroli. We do a personal care agency, Home Solutions, dealing with the caregivers with a lot of clients, mainly elderly. Used to do group home, closed that part. It didn't work out so much, but still trying to learn and update myself. Thank you and welcome.
Great. Good to have you today. Thanks, Giovanni. Katie?
Oh, I didn't realize I was not muted.
I just unmuted you, Katie.
Oh, okay. I
Yeah.
had to panic for a second. I'm Katie Malden. I'm a UNR Med PA student. I'm in the end of my first year, about to go to rotations in August, and I'm just doing this partially because our school wants us to do these CMEs for our portfolio building, and partially because I actually am interested in these topics. So this is my first one, and I'm excited to see how this works.
Excellent. Thanks for joining us today, Katie. It's Sarah. Go ahead, Sarah.
Hi, good afternoon. My name is Sarah. I'm with Dignity Health Medical Foundation in Las Vegas.
Thanks, Sarah. Good
I'm a social worker.
Great. Thank you. Vanika, could you introduce yourself, please? It looks like you're off mute. If you have a microphone, we should be able to hear you.
Yes, sorry about that. Hello, everyone. My name is Vanika. I am a licensed social worker, and I work for hospice agency in the Las Vegas area. And this is my first time actually attending one of these forums.
Excellent. Good to have you joining us today. Thank you. Lindsay Butcher, looks like you're joined by the phone. I'll unmute you. You could introduce yourself, please.
Hi, I'm Lindsay Butcher. I'm a nurse practitioner at the CLC, the VA up here in Reno.
Thanks, Lindsay. Good to have you joining us today. Dr. Joseph Loderhos. Dr. Loderhos, if you unmute yourself with the little microphone icon on the Zoom toolbar, we'll be able to hear you for introductions. Oh, looks like we've lost him. So we'll move on here then. Mary McKenzie. Mary, I'll unmute you if you could introduce yourself, please.
Hi, I'm.
Oh, we could hear you.
I need to get on.
Mary, we could hear you. All right, maybe we'll come back to Mary. Dr. Altamimi, I see you joined us.
Hi, I'm Dr. Altamimi Anshour. I'm a medicine geriatrician. I work with Nevada Health Center, QFHC in Carson City.
Thanks, Dr. Altamimi. Good to have you today. And then Tracy Bowles. Tracy, I see you just joined us. Could you introduce yourself, please?
Hi, I'm Tracy Bowles, Washoe County Public Guardian.
Thanks, Tracy. Good to have you joining us today. All right, Mary, any luck? Can we do introductions for you?
Can you hear me now?
Yep, go ahead.
Okay. Yeah, I have to scroll back to unmute. I'm an RN, largely retired at this point, living in Minden, Nevada, and just trying to help where I see there's a need.
Thanks, Mary. Good to have you joining us today from Minden. All right. So a couple housekeeping items. We do record all of these sessions, so if you don't want to be on the recording that we post, let us know and we can actually edit you out of any video that we do. The other one is if you present a patient case, which we're going to go to right now, please just don't disclose any protected health information. Obviously, we're in a group setting here today, and we want to avoid any HIPAA violations. And then the last thing is just about the CME or CEU credit that we have available to you today. So we have AMA PRA Category 1, nursing, and then we have BELTCA. So those of you who are long-term care administrators, you can claim the BELTCA credit for joining the session today. So I'll send out the information for that at the end. You'll have to submit an evaluation to claim those. So like I said, really our goal is supporting you in your practices and any patient care, patient questions that you have. So does anybody joining us today have a specific issue or question that they want to run by the team? Please feel free to unmute yourselves with the microphone icon on the Zoom toolbar, or I think a couple are joined by phone, so that'll be *6 to unmute yourselves. All right, so we'll go on now with the didactic presentation from Jamie today. Throughout the didactic, please feel free to chime in. You can unmute yourselves and interrupt us, or write in through the chat box any comments or questions that you have. So Jamie, I'll pull up your slides here and I will follow along with you as we go along here.
Thank you so much.
So a couple housekeeping items. Again, just a disclaimer letting you know that we do record these sessions, as well as please don't disclose any protected health information. Vanika did a great job of that. And then this is our survey that we're asking you to complete as part of your participation in this series. So I will send out the link through the chat box to the survey for you to have and complete that on your own time. So Jamie, we will go ahead here and get started.
Awesome, thank you so much, Troy. So hi everybody, again, my name is Jamie Ahumada, and today we'll be discussing how to access resources through Nevada Care Connection. Sorry. Oh, thank you. So today's learning objectives are how individuals can be supported to make informed choices about long-term services and supports, and when and how to make those referrals to the Nevada Care Connection partners. Next slide, please. Sorry. So what does no wrong door mean? I remember, just to kind of take a little bit of a step back, so I remember when I was a social worker in the field providing those direct services and finding myself on many occasions, making those phone calls, talking to so many people, getting on wait lists for programs, looking for resources and services that would meet my clients' needs. And at times finding myself stuck, not knowing what else was out there. So part of the No Wrong Door initiative aims to help create a one-stop shop through the Nevada Care Connection Resource Center so that you and your client can get unbiased information, able to make informed decisions, and get connected to the resources that meets their needs. There are different ways to tap into this network. Next slide, please. I would like to start off with our Nevada 211. So they typically provide information and referral services to connect individuals to service providers. This includes connecting to the Nevada Care Connection Resource Centers when appropriate, or when people ask for it specifically. I like to think of 211 as more like a large phone book that can be utilized to find that contact information for different resources within your own communities. And I'm not sure if many people have been able to jump on their website recently, but they have made many improvements over the last few years. They've implemented guided searches to help navigate through the vast amount of information on their site. I really like their call feature and appreciate their phone specialists, as they're very friendly, patient, and really get the people the information that they need. They also, at the end of the call, ask the caller, would they like a follow-up within 10 business days? And they actually call and follow up, which is really nice. And then there's also, when they do follow up, they also ask if they got connected to this resource and if there's anything else that they can help with in providing them information. It's also just nice to have that live person to talk to. And this is also true with their texting mechanism. And I've tried all three ways: online, phone, and texting, and it all seems to be able to provide me the information that I was looking for. They're continuously updating and expanding on being inclusive of all health and human organizations available through Nevada. So building onto that information and referral services offered by 211 is the resource and service navigation. That service is exclusively available with Nevada Care Connection Networks. Resource and service navigation, just to give you a little bit of a background, is also known as person-centered counseling as a formal point of entry into long-term services and supports. Our specialists, also known as resource navigators, help individuals explore the full range of options available to meet individual goals and needs, which can include public programs, informal supports, private pay options, and veteran benefits, which then leads into the long-term services and supports programs network that Nevada Care Connection taps into, which can be state agencies such as ADSD, Nevada Medicaid, welfare and supportive services, public behavioral health programs. And they're also embedded into our community organizations that include funded ADSD partners that provide direct services, our community organizations, family resource centers, centers for independent living, and many, many more that provide that direct service to individuals and families across the lifespan. So they're not specifically just for the elderly or disabled, but for everybody across the lifespan. Next slide, please. Thank you. So as I'm sure we're all aware of, that navigating the long-term services and support system is just not an easy task. So people do need to know where to go for more information and assistance. Next slide, please. So we'll talk a little bit about Nevada Care Connection and what they do, who they are, and a little bit of insight on how they provide this resource and service navigation. So you're also aware of how these services are provided to our clients and our people. So thank you. So what do Nevada Care Connection Resource Centers do? So at the core of Nevada Care Connection are the individuals that we serve, our clients. Person-centered practices give individuals choice and control over the services they receive. That is how they begin to explore what options are available to the client, put a plan of care into place based on their options and choices, and they help with getting the clients connected to services by application assistance, placing referrals, and working with providers such as yourselves when you share a mutual client. We've also incorporated caregiver support by identifying caregivers that reach out to Nevada Care Connection and assist them with what they originally called in for, as well as seeing if they also need supports and services for themselves as caregivers. And then we also have a veterans program that helps get connected veterans home-based care that meet their needs. At this time, that specific program is just limited to our northeastern Nevada and some of Las Vegas area, but we're hoping to expand on that coming soon. Next slide, please. So and I know I just went through a lot, so if anybody has any questions, please feel free to interrupt me and I'll be happy to answer any questions. So our resource and service navigation is a process that entails person-centered planning, as I mentioned before, which is the conversation that leads into exploring options. States have different names for this planning. It's often referred to as options counseling or person-centered planning, but in Nevada, we call this planning resource and service navigation to truly illustrate the depth and extent of the support available to the client and to emphasize that we are merely act as support and a navigator to the individual, and the individual leads and decides, and they're the decision maker of this process. And so they, I'm sorry, and then according to our Administration for Community Living National Standards for Options Counseling defines this as an interactive process where individuals receive guidance in their deliberations to make informed choices about their long-term services and supports. In a process, the process is directed by the individual to include others that the person chooses or that are legally authorized to represent the individual. Next slide, please. So how do they do this? So I just want to give you, this slide really illustrates what resource navigation is on our end, on this side of the thing. Using person-centered planning, the navigator will identify the person's needs, both immediate and long-term. So then identifying options to meet those long-term needs, the individual chooses the options they want to include in their plan. Options will often include public programs or programs outside of public programs. And then the options are based on the quality of options available to achieve those goals of the plan, not necessarily the quantity of options available. So if you see, we can immediately, discuss food and what food options are available, and then we take a look at their long-term, which is, housing, transportation, and things like that, and what options are available to them in their areas. Next slide, thank you. So making a referral, and the next slide, please. So I would like to go over the Assess My Needs. It is, I don't know if it was sent out as a handout, but I just wanted to take a quick look at that form to give you a little bit of insight on what that entails and what that information means. So this was created to help you as a provider and your clients understand what information is important when sending in an Assess My Needs request. If the individual can do the Assess My Needs on their own and have access to computer, or if they know somebody that has a computer and can help them, but it could be a friend, neighbor, family, a senior center director, anybody that could help them have access to a computer, or you as a provider can also make the referrals on behalf of your patients or clients, so that if they do not have computer access, we can be we can be linked to obtaining the information. Oh, sorry. Whew, I am going ahead of myself. So if they don't have computer access, you're able to be that link for the person and fill out the Assess My Needs form on their behalf. And just to clarify a little bit, the navigators will work with you to talk about what services you have provided, or are providing, and get a little bit more insight on the needs of the individual to figure out what services are available through this collaborative effort. So that way they're not trying to reinvent the wheel that has already been done. So we're trying to look at other options outside of what you have done as a provider for this person. And I see that the referral form is up. So it just kind of gives you step-by-step, and this can be given to your clients. It could also be for you to use. Gives you the URL where it says to connect. In blue, the little self-assessment link is on there. You'll click on that, and then you'll just read the instructions and fill out the information listed in the application. There are some required fields, but really at a minimum, we are asking for full name and address, including a zip code, just to know where to connect you or where your clients are at or anything like that, in a way to contact them. And then this is the actual form, just to kind of give you a little bit of insight on what information is really necessary. There's boxes in here in section 2, just to kind of give us a little bit of more information. If you don't know the person's living situation, you can always put unknown, but it's helpful to know what their living situation is. And if you could scroll down just a little bit for me, please. Again, you know, just having these boxes in step 6, providing the individual with or giving us this information on the individual's basic information, just so we know as well when the navigators contact the individual, they'll know, okay, you know, this person needs they have a medical condition and they need these services, or if they have a physical condition or a disability, they need these kinds of services. And it'll just give us a little bit more insight on that person. You can scroll down just a little bit, and I think there's an additional information. I think any kind of details that you can share based on your client is helpful as well, just because when we make those phone calls, or when the resource centers make those phone calls, they'll be able to say, okay, you know, this person needs a little bit of time to answer, or they're hard of hearing, or we need to talk very slow. They're aware of that, so when they're making that phone call, that lessens a little bit of the frustration on the client side when somebody is talking too fast or too soft, or whatever it is that they need to get that contact. And then I think there is a section here, submitter information. If you are going to submit on behalf of your client, there's a place where you can put in your information, which I think would be helpful for the navigators as well, to work with you, again, for that collaborative effort to meet your client's needs. And then the rest is just the contact information and submit. It's a fairly quick and easy form. I just wanted to go through some of those explanations, but that gives people a little bit more of an insight on what that form looks like. And so when should you refer to Nevada Care Connection? So when you do have clients that have those complex needs, are at risk of institutionalization, aren't eligible for waivers services. Sometimes we find clients that are in that gray area where they don't qualify for waivers, but they need some more supportive services. They can help provide that information or options to your clients. And I think, does anybody have any questions?
Thanks, Jamie. Great information. So a question already came in from Tracy, and all of you joining us today, please feel free to write in through the chat box or unmute yourselves to ask questions right now. So some of the most challenging cases we see are elderly who are not meeting their own needs but refuse assistance, and who don't qualify for legal holds or guardianship services. Do you have any advice for providers dealing with these situations?
You know, that is such a tough balance. You know, I think that there, you know, we have, I'm sorry, let me make sure I phrase this correctly. So as providers, you know, we do have to give our clients the opportunity for self-determination. And at times, you know, they may not want that service. And I think having a conversation with them and not necessarily saying, you know, they need help, but really putting it into perspective of, you know, how we can support them for them to stay independent and for them to stay at home, and just even hearing out what these supports look like. I would come across a lot of my clients when I was working in the field that would be hesitant or reluctant to even take a look at what these supports look like, because they felt as if they were being handed services, or they felt like their independence was taken away, when in fact it's not that. It's giving them those supports. So it's having that discussion with them. If it really is something where they're at risk of hurting themselves or others, or at risk at any kind of harm, then I would really suggest to reach out to our adult protective services and have them be able to have those conversations with them as well, to let them know of the risks and see what supports can be provided to them. I hope that answered your question.
Thanks, Jamie. Tracy, I'll unmute you. Do you have any other follow-up to that?
No, I think it highlights just the challenging situation and some of the fine lines that our elderly people in our community experience. And I do think I see a lot of providers who struggle with that self-determination piece. They want to afford the person the right to make their own choices, but they don't know necessarily where that line is. And they see people decompensating in their homes and not accepting service. So I think you just highlight how challenging that situation really is.
Absolutely, I agree. That is such a challenging and a fine line.
Hey Tracy, Mordechai Levy here. I'll offer something that I found kind of successful in kind of starting these conversations, but kind of completely agree with kind of the difficult nature that that these types of issues just kind of bring up. Is starting with kind of what matters to the patient or the person, and you know, understanding kind of why they want to stay at home and why that matters to them, and potentially being able to kind of bring in all of the resources kind of Jamie shared with us today as kind of a way to support what matters to them, whether it's staying at home or staying as independent as possible. And you know, even if that's kind of bringing in kind of another treatment plan, especially for chronic conditions, because, you know, it's really tough to sustain a chronic condition at home alone versus kind of sustaining a chronic condition in a nursing home. And, you know, they just kind of have different natural histories. And so kind of starting from what matters and kind of then hopefully being able to kind of align your priorities from that perspective, and then bringing in some of Jamie's perspectives has been successful for me in the past.
Thank you.
I think that's a great point. Thank you.
Thanks for the question, Tracy. Question from Kelly McMillan. If I complete the online Assess My Needs, how long before a service navigator contacts the person?
Great question, Kelly. So at this time, it is taking anywhere between 48 to 72 hours, so 2 to 3 business days to be in contact with one of our resource navigators and start that process. There may be a little bit of a time lag sometimes, but that's usually their time frame is 2 to 3 business days. And we're looking to hopefully have a little bit of faster turnaround, especially of what's going on right now with COVID. They're trying to get those requests turned around a lot quicker than normal.
Thank you. And another question to follow up is, given the circumstances, how has the Nevada Care Connection expanded to sort of deal with a larger population base that might not otherwise seek services?
Yeah, they have started to implement or recruit some more resource navigators to help with that influx through a funding that we received from the federal government to help support the influx of all of these people reaching out that weren't reaching out before. And we're also in the same network with Nevada Can, where we're all working in this collaboratively together. So they're able to do the rapid response to anybody that needs food, medication, telehealth services, and social support services through Nevada Can to quickly get those people those services. And then our Nevada Care Connection resource centers are taking over anybody that requests for help outside of those areas. So we're working together on this as community.
All right, Jamie, a couple other questions that have come in here. One from Sarah. Could you talk a little bit about how your agency is funded?
Absolutely. So this is funded through our Title IIIB funding, which is our funding that we get through ADSD. And then we fund out to our Nevada Care Connection resource centers, our partners that take on these services. I don't have so much information on the funding part that I can give you concrete information, but I can gather that and send it out if you'd like. I'm just not well versed in that.
No worries. Thanks, Jamie. A question from Mary back to the online Assess My Needs form. Is feedback provided to the person making the request? So I think, Mary, correct me if I'm wrong, you're meaning if it's the situation where a care provider submits that form, is there any communication back to that care provider?
Yes. So if you include your contact information and put in the notes that you would like some feedback or you like to work with the resource navigator to help provide support to your client, absolutely. They'll contact you to really work and see what have you done, what have you been doing, and then that way you can put your heads together to find other alternatives if necessary, and kind of seek out different resources that are available.
Great, thanks for the questions, everybody. We've got lots of time left, about 20 minutes here. So any other questions for Jamie or the team? Again, we're here for specific patient-related issues or questions that you may have. So anything out there that we can help you with.
I'll speak up here, I'll put a plug in. So I've actually gone to the Nevada 211 website, and it is much, much better. I mean, there's information that you can actually find about current services and any program that is funded through Aging Disability Services Division lists their programs there, but it's open to anybody who provides services. There's I think somewhere on the website, there's a way to request that. And I have used the Assess My Needs piece for myself with clients we refer from our clinic. And I find it just very efficient and a quick way to make referrals. And so I really appreciate the functionality of that.
Thanks, Kelly.
Yeah, thanks for sharing. All right, a couple other questions coming in. Thanks everybody for staying engaged and asking some questions here. So another question from Sarah. Many of our state or county resources have lengthy wait times. If a referral is made by your agency, does that case get priority to get those services?
Sorry, many of our state, I have to reread that question, I'm sorry.
And Sarah, if you don't mind, I'll unmute you, and can you explain a little bit more about your question?
Sure. As a social worker, certainly, you know, our county state is based on eligibility, marital status, if they qualify for those services. Often, majority of the time, I should say, there is a wait list. There is nothing that's immediate. So I was just wondering if using your referral, does that prioritize that person in any way, or?
Unfortunately, it doesn't, and the reason for that is because, how do I explain? It's, you know, we're looking at everybody as individuals, and so it, you know, we try to prioritize everybody and try to get them what they need through resource and service navigation. I don't think that it would be prioritized within these wait lists that, you know, it coming from our Nevada Care Connection resource centers, but certainly it does help when they help apply for assistance, because they, when they help with the application assistance, I'm sorry, as they get information or they require some more additional information from your client, then they help facilitate that. They help your client get those documents together and review those and that information before they submit it, and kind of have that interaction with them throughout the process. So it, in a sense, it does sometimes help, but I don't think it really would address the wait list, but they can find other alternatives to that while they wait for the wait list to call them back.
Are the navigators able to assist with the paperwork and do home visits to help with that?
Yes, home visits, yes, they can. It'll be a little bit more regular as we hit July 1st, as we've incorporated case management into our resource and service navigation for those that have a higher level of cognitive need.
Got it. Thank you.
So, yeah, they'll help with that.
Thank you.
No problem.
Sarah, great question. A question from Tracy. Who updates the 211 resources, and who's responsible for that?
So from my understanding with 211, each organization that provides their information to be entered into 211, we update it as we go. 211 usually sends out reminders, I believe annually or semi-annually, I don't remember. They reach out and they say, hey, is this the correct information? If not, please update. So there's ways to either you do it yourself or they help remind you throughout the year. And they continue to try to bring in more providers through the state as well, through outreach.
Thanks, Jamie. Could you provide a couple examples of specific clients that you've assisted?
Yes, so we have, like I had mentioned before, so we have assisted, you know, clients throughout the lifespan. Our resource navigators have assisted individuals that are seeking for supports and services that don't necessarily meet waiver requirements, but they still need those additional supports like food stamps, or if they just need assistive technology, they get them connected to those resources. I've had them also, I have heard of them assisting as well with Social Security benefits, disability benefits. They help with that application process. They help with care transition from hospitalization back into the home at times if home health is not an option, or if it's going to take a little bit longer for them. They've helped to make sure that they get the supports and services they need going back home. It really varies, you know, from client to client. As we all know, we deal with a variety of different families, low income, higher level of income. They look into private pay services. So if they do have that higher based income, then they won't look at public programs, but they'll look at what's available out in the community that can be offered and where they could pay privately. I hope that kind of answers. The range is just very wide with all of that.
Yeah, great answer. Thanks, Jamie. Question from Ross V. Did you say that they screen for veterans benefits?
They do. So right now we have a veterans program, and it's only right now limited to our northeastern Nevada area and in Las Vegas, but very limited. Those veterans have to be service connected, and then they would have to go through the VA in Idaho. And I know that, I'm sorry, Utah, not Idaho, in Utah, Salt Lake City Veterans Department. And what they do is, if they're connected with that specific veterans hospital or program, they help with the home and community-based care that a veteran may need. So if they need assistance with their ADLs or IADLs, they can provide that service for them. And it's self-directed as well. So which means they would be able to choose, you know, who provides them the care. They can go through a provider, or they can go through a neighbor, or even their spouse at times can help them with those services.
Great, good questions, everybody. Any other questions before we kind of wrap up for the day? Dr. Levine?
Yeah, hey, Mordechai Levy here again. Just wanted to say I've been using, you know, over the last few weeks, maybe a little longer now, I'm using a lot more of Nevada 211 in my clinical work and sharing it with some of my partners too. And, you know, just kind of found it to be a real streamlined approach. And I think that if Jamie shared that, is, you know, it really connects a lot of things that already exist out there. And they've kind of done it before and they know what they're doing. Still not necessarily an easy process or a fast process. But really streamlines, kind of gets everything moving, and you know, kind of still waiting on kind of some of the things. You know, it's only been a couple of weeks, but kind of feel like it's making a bigger difference in the people's lives that I'm part of and I help take care of. So I think it's a great resource. Just kind of wanted to put that plug. So thank you, Jamie.
Thank you.
Patty just sent out Nevada ADSD and FEMA PSA to spread the word about Nevada CAN. Patty, do you want to talk a little bit about Nevada CAN?
Sure, we talked about that a little bit last time. And so Nevada CAN is an initiative that was put together to address the needs of individuals who would be, you know, staying at home during the COVID-19. And of course, we have no idea what that's going to look like, especially for elders. And so there's kind of 3 areas of focus. One is on making sure that homebound elders have access to food and medication or other necessities. A second team is available to provide social support through phone calls or Zoom, you know, group meeting connections. And then the third is a telehealth initiative where you could, or they could obtain some, like a medical consult or social support services. And I know Kelly's offered some of those services through the clinic. This is offered statewide. And then we know that there are some individuals who have limited access. So there's some others that are trying to get Kindles or other kind of technology that could be loaned or supported, provided to individuals who wouldn't have the means to be able to access those online services.
Great, thanks, Patty. And I'll keep it on you for a second here for our couple housekeeping and wrap-up items. So you can talk a little bit about the survey.
So as was mentioned in the beginning, if you look through the slides, we have funding that's provided from HRSA for our Geriatric Workforce Enhancement Program. And we have a survey here. We just ask you to fill that out once so that we have your demographic information, you know, kind of like your name, rank, serial number kind of stuff. And so if you would complete that, we would really appreciate it so we can track and report the kinds of people who come to our training. So really appreciate that. And what was the other thing, Troy? Oh yeah, so that's our funding information. And we also have funding from EJC Foundation to help support this geriatrics ECHO, as well as our geriatric specialty clinic, where we're offering telemedicine and have been during this pandemic. Our next training that we offer is going to be on Tuesday, June 16th, which is again the same format from 12 to 1. And we look forward to having you join us. We're going to have a combination discussion between palliative care and geriatric care and how they might have a different approach as they work with an older adult.
Great. Thank you, Patty.
Yeah, thank you.
A couple other of my own announcements here. So there were some questions about how to retrieve the slides from today. So I'll send out the link again through the chat box here to our website, which is where you'll find everything here. So just a second, and I will send that out. So yeah, this is our Geriatrics Echo Clinic webpage. You'll find pretty much everything here that you'll need. So the first link you'll find is the case review form. So if you have a case for our next session in June, please go there and submit that to us for review. And then if you keep scrolling down here, you'll find everything from today's session. So this is a link here. That'll be the PowerPoint slides. There's another resource guide that Jamie shared. And then this will be the Assess My Needs form that we took a look at earlier. So that'll download as a PDF for you on there. So as we mentioned, our next session is Tuesday, June 16th. I'm going to update the topic there. As we talked about, it's going to be geriatrics and palliative crossover. So yeah, thank you so much, everybody. Don't forget to claim the CME or CEU here. As I said, we've got AMA, PRA Category 1, Nursing, and BELTCA credit for you today. So please submit that evaluation so you can get your credit on that. And just the last thing is that we ask you to complete our post-session survey, just so we know how we did today. So I will launch that right now for you to reply to. And thank you so much, everybody. Good to have you today. And we hope you'll join us again in the future. And then just the hub team, if we can stay on for a couple minutes to debrief.